Hello, in this tutorial we are going to visualize arrhythmias. Now, to visualize arrhythmias on ECG, you need to first divide arrhythmia into two. You are going to have still your diagram of a schematic diagram of the heart. You divide it into two. You have supraventricular arrhythmia and you have ventricular arrhythmias. Is it clear? Generally, the supraventricular arrhythmias come from everything that is above the ventricles. Supraventricular arrhythmias. Is it clear? So I will just specifically call this tachyarrhythmia because the bradyarrhythmias we have visualized it in the conductive disorders, and then the tachyarrhythmias are going to be visualized in this part of the thorax arrhythmias. So you have supraventricular arrhythmias and you have also infraventricular, or you have also ventricular arrhythmias. Now, those are the different things that you have to visualize. Now, for the first point, supraventricular arrhythmias. Supraventricular arrhythmias. For supraventricular arrhythmias, you can have tachyarrhythmias, which are coming from the sinoatrial nodes. Is it clear? So the first one is a tachyarrhythmia coming from the sinoatrial node, the sun. Is it clear? So in this case, it is going to be called a sinus tachycardia. So that's the first point, sinus tachycardia. Now, the next abnormality that you can have in supraventricular arrhythmia, we can have also a six sinus syndrome. Six sinus syndrome. Is it clear? Six sinus syndrome. Is it clear? In the six sinus syndrome, you have a sinus rhythm, but you have a bradycardia. Is it clear? So that's a six sinus syndrome. Is it clear? So those are the different things that you have to visualize. For the atrium, we have also supraventricular arrhythmias that are coming from the atrium. In this case, you can have an atrial extrasystole, which is also called a presystole. Is it clear? So those are the different things. So the next one on the atrium, we have atrial fibrillation. Is it clear? Which is also going to be a tachyarrhythmia, atrial fibrillation. And the last one is going to be the atrial flutters. Those are the different tachyarrhythmias that you have to visualize. Now, after that, those tachyarrhythmias, you have now the next point, which is the next tachyarrhythmia is going to be coming from a ventricular arrhythmias. Now, inside the ventricular arrhythmias, you can have ventricular tachycardia. Is it clear? So you can have ventricular tachycardia under ventricular arrhythmias. You have the next point, you have ventricular fibrillation. Is it clear? So generally, those are the ventricular arrhythmias that you can visualize. So let's start now with the ECG interpretation of supraventricular arrhythmias. For the ECG interpretation of supraventricular arrhythmias, this will be the sinus tachycardia. Generally, how does sinus tachycardia present? You have a patient that has a sinus rhythm, is it clear? But the heart rate is going to be elevated. Is it clear? So if you have a patient that has a sinus rhythm and then you measure the heart rate, it is more than 100 beats per minute. By using any of your rules, is going to be the sinus tachycardia. That is how you make a diagnosis of sinus tachycardia. And there are different causes of sinus tachycardia, particularly physiological causes of sinus tachycardia, like fever. Fever can result to sinus tachycardia. Generally, you have to know that an increase of 1 degree Celsius is going to increase the heart rate by 10 beats per minute. Is it clear? And it's also going to increase the respiratory rate by 4 breaths per minute or 4 cycles per minute. So those are the different things that you have to know. So now, after the sinus tachycardia, the next point that you have to visualize after the sinus tachycardia is going to be the six sinus syndrome. Is it clear? Six sinus syndrome. Now, under six sinus syndrome, we have under the six sinus syndrome, we have to know that there is going to be under the six sinus syndrome, we have to know that there is going to be the different things. Six sinus syndrome, there is going to be, for the six sinus syndrome, you're going to have a sinus bradycardia and you have also an extra systole. Is it clear? So if you visualize a sinus bradycardia and a ventricular extra systole, just know that it is much more of a sick sinus syndrome. What do I mean by that? You have a P wave that is going to follow a QRS complex, but it's going to be very weak. Is it clear? Then you have a P wave with a QRS complex. Then you have a bradycardia, and then at one point in time, you have no P wave. Is it clear? But you have an extra systole. Is it clear? So this is an extra systole. An extra systole is a prolonged malformed QRS complex. Is it clear? That's a ventricular extra systole. So this, if you have a P wave, then you have a QRS complex, then you have a prolonged QT interval showing that the heart rate is going to be very low. Is it clear? Then you have another P wave with a QRS complex with a prolonged QRS interval, but in between that prolonged QRS interval, you have an extra systole. It is much more a diagnosis of a sick sinus syndrome. Is it clear? So those are the different elements that you have to note. Now, the next point that you have to note is the for the case of the atrial abnormalities. Is it clear? So for the atrial arrhythmias, you have the atrial extra systole. Is it clear? Atrial extra systole. For atrial extra systole, generally they are going to be presented as bifid P waves. Then you have QRS complex T waves. Then you have a bifid P wave, then QRS complex, then your T wave. Generally, the bifid P wave of the atrial extra systole is going to be located on all the leads. Is it clear? So when it affects, it's going to be all through the different leads. So let's say that this is lead 1, here's lead 2, here's lead 3, here's AVR, here's AVL, here's AVF, similarly V1, V2, and V3. Is it clear? It is going to affect. So if you have a bifid P wave, you're going to visualize the bifid P wave all through the leads here. If you have a bifid P wave here, you're going to visualize all through the leads. If you have a bifid, you're going to visualize. When you visualize the bifid P wave all through the leads, it's going to be an atrial extra systole. While if you just visualize the bifid P wave on the lead 2, it corresponds to a left atrial enlargement. Now, the next thing after the atrial extra systole, we have atrial fibrillation. Is it clear? Atrial fibrillation. So how do you visualize atrial fibrillation on ECG? Is it clear? To visualize atrial fibrillation on ECG, the first element that you are going to visualize on ECG is going to be sinus tachycardia. So is it clear? So generally, you have tachycardia that you're going to visualize on ECG. Is it clear? So when you have tachycardia, so I just prefer to say sinus tachycardia or tachycardia that you visualize on ECG. So you measure, you are going to have tachycardia you're going to see on ECG. It's one sign of atrial fibrillation, but it's not the pathognomonic signs. So this is just a general sign. So for the pathognomonic sign on the ECG for atrial fibrillation, the first one that you have undulating baseline. Is it clear? Undulating baseline. So in undulating baseline, how does it show? So generally, you have a baseline as such QRS complex, you have a baseline as such QRS complex, baseline as such QRS complex. But the QRS complex, they are not abnormal, they are normal QRS complexes. Then you have, this is an undulating baseline. Is it clear? That is one pathognomonic sign. The second pathognomonic sign is an absent P wave. Is it clear? The P waves are absent because there is no syncytial or a together contraction of the atrium. Is it clear? The atrium are not contracting together, but each part of the atrium are contracting independently. That is why they are producing this undulating baseline. They are not producing one P wave. Is it clear? Normally, the atrium is supposed to contract as a syncytium all together. But since in atrial fibrillation, there is a pathology which makes each part of the atrium to contract independently, you are going to have this undulating baseline and you have an absent P wave. Now, the next thing is that since you have this undulating baseline, the atrium is not contracting at the same instant, you are also going to have an irregular RR interval. So when you measure this R wave interval and you measure another R wave interval, it's going to be shorter. You measure another R wave interval, you are going to have an irregular RR interval. Is it clear? So those are the three pathognomonic signs of atrial fibrillation on the ECG. In addition to that, you can have sinus tachycardia, but sinus tachycardia is not a pathognomonic sign. Is it clear? So those are the different things that you have to visualize for atrial fibrillation. The next one is atrial flutters. Is it clear? Now in atrial flutters, similarly like atrial fibrillation, the atrium do not contract together, but the independent part of the atrium that are contracting together are much more than the atrial fibrillation. Atrial fibrillation is like one muscle cell is contracting at a time. Is it clear? One muscle cell of the atrium is contracting at a time. While in the case of atrial flutter, it is a group of muscle cells contracting at a time in the atrium. Is it clear? So in this case, the pathognomonic sign is going to be a flutter wave. So you have flutter waves like that, and then you have your QRS complex, then you have your flutter waves, then you have your QRS complex, then you have your flutter waves. So when you see flutter waves, so those flutter waves are sawtooth waves. Is it clear? So if you see these sawtooth waves like this, just know that when you see this sawtooth baseline, the baseline which is sawtooth, they are called flutter waves. Is it clear? So just know that it is typical of atrial flutter. Is it clear? So those are the different signs of the ECG for atrial fibrillation and the supraventricular arrhythmias. Now we move on to the next part of the ECG interpretation for arrhythmias, which is the ventricular arrhythmias. Ventricular arrhythmias. Now, for ventricular arrhythmias, we typically have the first one, ventricular extrasystole. Is it clear? Ventricular extrasystole. Now, for ventricular extrasystole, how does it present? In ventricular extrasystole, you are going to have a malformed QRS complex. Is it clear? So if you have a P wave, then you have a QRS complex, then a T wave. Then at one point in time, you have a malformed QRS complex as such like that. Then you have a P wave, then you have a QRS complex like this. So this is a P wave, a normal QRS complex, and a T wave. This is a malformed QRS complex without a P wave before. Is it clear? And then you have a P wave, the QRS complex, that is normal. So every time that you have a malformed QRS complex which is prolonged, so those malformed QRS complexes are called dysmorphic. Just to use the typical word, when you have dysmorphic QRS complex and it is prolonged, is it clear? It is much more of a ventricular extrasystole. Now, you have to know also that it is ventricular extrasystole because there is no P wave preceding the QRS complex. There is no P wave preceding the QRS complex in a case of a ventricular extrasystole. Is it clear? So in a ventricular extrasystole, there is no P wave preceding the QRS complex. The QRS complex are dysmorphic and they are prolonged. Is it clear? Now, if there is a P wave that precedes the QRS complex, it is a supraventricular arrhythmia and not a ventricular arrhythmia. Is it clear? It is not, the etiology is not coming from the up the ventricle, that is in the atrium, but it's instead coming from the ventricle. So if you have a P wave that precedes the dysmorphic QRS complex, it means that it is coming from above the ventricle, that is inside the atrium. But if it is, you have a P wave that do not precede, is it clear? It means that it's coming from the ventricle, that is a ventricular extrasystole. And another peculiarity of ventricular extrasystole is going to be located similarly like atrial extrasystole. It's going to be located on all the leads. Is it clear? If this is lead 1, it's also going to be located on lead 2, on lead 3, and all the leads typically is going to be located there. That's for ventricular extrasystole. The next point after ventricular extrasystole is ventricular tachycardia. Ventricular tachycardia. Now, in ventricular tachycardia, what you're going to have are dysmorphic. We are going to have dysmorphic QRS complex all through the ECG paper. So this is how it's going to be located. So you have this. So these are dysmorphic QRS complex that you are going to see all through the ECG paper. Is it clear? And when you measure the rate, is it clear? It's going to be tachycardia greater than 100 beats per minute. So you measure the rate by the use of the rule of 300 or any rule based on the regularity. So you measure the rate and it's going to be greater than 100 beats per minute. And you have dysmorphic QRS complexes that are not preceded by the P waves. There are no P waves that precede these dysmorphic QRS complexes. Is it clear? So when you have dysmorphic QRS complexes which are prolonged, and then the heart rate is going to be high, is going to correspond to a ventricular tachycardia. Is it clear? And generally for ventricular tachycardia, it's all true. It is not one that is normal QRS complex and then you have one dysmorphic. No, it is all true that you have dysmorphic, and when you measure the rate, it's going to be high. Is it clear? That is ventricular tachycardia. Now, the next thing is in case where you have dysmorphic all true, when you visualize dysmorphic all true, but it is not tachycardic, it is instead bradycardic. It is meaning that you instead have an abnormality of the sinoatrial node. It's also another form of a sick sinus syndrome, where in this case there is already an ectopic foci. Is it clear? In this case, normally the pacemaker has to be at the level of the sinoatrial node. But if you have the dysmorphic QRS complexes with the heart rate that is not greater than 100 beats per minute, means that the pacemaker is coming out of the atrium and the pacemaker is inside the ventricle. Is it clear? And that's why it is called a ventricular tachycardia. The etiology is coming from the ventricle. Now, the next element is ventricular fibrillation. For ventricular fibrillation, what you just have are fibrillating waves. You have this like this. It's just like as such. So you have this wave. When you see all through this on ECG, that is ventricular fibrillation. There is no particular morphology. So there is no pattern. So when you see this like that on ECG, that's ventricular fibrillation. And the last element is a cardiac arrest. You have your heart rate and then you have this straight line. It tells you cardiac arrest. Is it clear? So those are the different elements that you have to visualize on the ECG. Is it clear?